Good afternoon, everyone. On behalf of Texila American University, we welcome you on this particular conference about the topic, World is in Need of Doctors. Are you ready for the wave? So I hereby welcome our Dean, College of Medicine, Brigadier General Lawson Simapuka, Dean, College of Medicine. A short description about our speaker. He's an experienced medical director with a demonstrated history of working in the hospital and healthcare industry. Skilled in epidemiology, program evaluation, disaster response, operational planning, and organizational leadership. A strong business development professional with a Master of Science in Clinical Research and Master of Public Health from the University of Liverpool, United Kingdom, and the University of Zambia, respectively. Also holds a fellowship in infectious diseases, epidemiology, and tropic medicine from the German Novel Medical Institute, Rochgain, Plab. So, Dr. Lawson Simapuka, we welcome you on board for this particular webinar. Yes, Doctor, good afternoon. Welcome on board. Thank you for your available
Thank you very much.
time. The audience are waiting for your presentation session for the day.
Okay, thank you very much. Yeah. So I think there was a technical problem earlier on. I could not be heard on the other end, and that has been sorted out. Yeah. First and foremost, I'd love to welcome you to today's presentation. Our presentation is on a topical issue. The world is in need of doctors. Are we ready for the wave? I think it's important for us to understand before I go into my presentation that from time immemorial, from the medieval era to today, modern day practice of medicine, there's never been a moment when the world has had a full complement of medical doctors. And that's the reason that across the region, be it in Europe, America, Asia, and Africa, there's always been need to find solution to fill in the gap for medical doctors. One, we've looked at expansion in medical training in country. Two, looking at task shifting. There are areas of practice that can be done by physician assistants, nurse practitioners, that can be moved from the core business of medical doctors. However, I think it's only true that any individual that walks into a health facility or when they get from their home, what comes out in their mind first is that they are going to see a medical doctor. And this is where the need for a trained medical doctor, and indeed not a fill-in or a substitute practitioner, is of paramount importance. Now, to train as a medical doctor, it requires a lot of resilience as an individual. It requires a lot of dedication and a lot of innovations on your part as an individual. It's something which should come in freely after years of one going through their secondary education. They should, through this period, be mentored according to their choice of career. And indeed, the practice of medicine requires an individual who comes into practice as a choice to become a medical doctor, because the amount of work, both as a student and indeed as a practitioner, is quite voluminous. Now, before I go into my presentation, let me come to the training of a medical doctor. A medical doctor has to be an all-rounder. And when you look at the training, it should be approached from all the three domains. Medical doctors need to be trained at the highest level in the cognitive domain. Cognitive domain is basically the domain that has to do with mental function. And if you look at Bloom's taxonomy, the training should be conducted at a very high level. The lowest in learning is at the level of knowledge, acquiring knowledge, followed by application, then analysis, and the highest is synthesis. Therefore, as a medical doctor, one has to go through pedagogy and indeed training, which makes them reach the highest level in terms of their cognitive capacity. And once that is acquired, that should be transferred into the psychomotor domain. As you are aware, medicine is both a science and an art. One needs to have the cognitive capacity to assimilate and retain knowledge, but that should be translated into practice. You cannot just be a knowledgeable medical doctor and then your skills are somehow not in place. Then lastly, medical doctors are role models. Medical doctors are leaders, and therefore the way one conducts themselves has a lot to do with what will be the outcome of the interaction with the patient. First contact, first impressions are very important. Therefore, what am I saying? What I'm saying is that a medical doctor is supposed to stand on very high grounds in terms of morality, in terms of attitudes and emotions. Basically, you should combine both the intelligence quotient and also emotional intelligence. So in a preamble, that's what is expected of us. Now, to fill in this gap, with that said, the world is really in need of medical doctors. But are we ready? That's a challenge that I throw to you. Therefore, I'll go through a few slides. They're just about 5, and then we'll have an interaction with each one of you. Yeah. So I'm Brigadier General Dr. Lawson Smapuka. I hold 2 specialties. I'm a public health physician and also an internal physician with super specialization in infectious diseases. I'm currently Chief Academic Officer and Dean of the College of Medicine, Texila American University, Zambia. So basically, I'll add on to the other opening remarks, and then we'll look at the effect of brain drain, then we'll look at the core values for a medical practitioner, and then we'll look at pillars of practice, and then we'll close and have our question answer session. So it's important for us to understand that according to Zambia Medical Journal and the World Health Organization, the indication is that the doctor-patient level ratio in Zambia and Sub-Saharan Africa is about 1 to 1,200. And this applies in Zambia and most of the Sub-Saharan countries. What does this entail? This shows that there is a very high demand both in Zambia Zimbabwe, Botswana, South Africa, and other sub-Saharan countries for medical doctors. In an ideal situation, we'll be looking at an acceptable standard for sub-Sahara, or maybe in Africa, of 1 to 500 patients. If you look at the Zambian scenario, we're looking at a scenario where there's a shortage of 3,000 plus medical doctors. And these medical doctors cannot be found with the number of institutions that we have in the country. And therefore, that's where a challenge comes in. So to address this shortage, governments in Sub-Sahara and indeed in Zambia has looked at the use of non-physician practitioners. Non-physician practitioners range from nurse assistants, physician assistants, or nurse practitioners. And these are the ones that would carry out some procedures, either medical or surgical, which would be a preserve for medical doctors. But there are some of those procedures that can be done by this cadre under supervision. But even if there is a stopgap, in inverted commas, this does not fulfill, or the cadre does not fulfill the role that a medical doctor can play. So what worsens the situation of the gap in terms of physician? It's important for us to understand that amongst the well-paying jobs in Sub-Sahara is that of a medical doctor. I'll give you an example. In Zambia, medical doctors are the highest paid civil servants outside the senior most civil servant who is supposed to be permanent secretary. But there's a challenge in retaining these medical doctors. The number of local universities as a way of increasing graduate doctors coming on the market has increased, but this cannot fill the gap as those that graduate move to other countries. And in the sub-region, we basically have inter-country drainage. Medical doctors move from one country to the other, still looking for better pay and indeed higher learning opportunities, leaving their native countries with most of the health posts vacant. Then the issue of brain drain has been worsened by a concept that I may refer to as internal brain drain. With the coming of HIV, you find that there are a lot of NGOs that have mushroomed, and they are employing medical doctors. So public institutions are again hit hard. You find internally in the country, not only have the doctors gone out, but you have medical doctors that have joined NGOs, and that further worsens the brain drain. So we have an external brain drain and an internal brain drain. So what are the core values in medicine? The following are the important core values that as physicians or physician as scientists we're supposed to uphold. One thing you should understand is that as you come into the practice of medicine, you need to understand that you are both a physician and a scientist. That is why the medical training has two components. pre-med, where you go through natural sciences and basic sciences to build you so that you are a rounded and grounded scientist. And then the clinical years, where now you apply your knowledge. So as you get into medical school, if we are to fill the gap of doctors, you need to have a clear vision, a sense of what one wants to accomplish in the world. In a medical school, you need to understand that you have 3 8-hour in a day, 8 hours of leisure, 8 hours of study, and 8 hours of sleep. I would suffice to mention that you need to readjust on the sleep and readjust on leisure and find an extra 1 hour in 24 hours if we have to achieve our vision. So it requires complete dedication once you get on the program. And as I mentioned, in our third domain, the affective domain, we have issues of integrity. One who trains to be a medical doctor need to have principles of life based on honesty and consistency. Then for you to achieve your vision, you need to be hardworking, persistent, and you should have the determination to move ahead despite setbacks. It's not easy, but with determination, you can always be what you're supposed to be and fill the gap that is there in as far as medical doctors are concerned. Then, as you get into your training, you need to be curious, curiosity. You're a scientist. You should have a mind that is always questioning why and how is this phenomenon the way it is? Why is it that this patient has been treated differently from the other patient? And indeed, you need to be confident. Confidence is very important, and it's something that should not be substituted with anything. You need to believe in yourself, and that allows you or one to challenge dogma and indeed take chances. Very important. So these are the values, core values that you need as you get into the practice or indeed training to become a medical doctor. So as you continue on your journey to becoming an outstanding physician and filling the gap of the shortage of medical doctors, I would suggest you keep in mind these 3 pillars of practice. 1, leadership. As I indicated earlier on, a medical doctor from day 1 is a leader. And how do you start? You start by realizing that from day 1 in your foundation course, you should stand out and be seen to be what you're supposed to be. Therefore, there's need for resilience and a powerful emotional intelligence. That will be the foundation of great leadership. And then this will be coupled up with the traits of empathy, humility, consistency, self-awareness, self-discipline, and generosity of spirit. These are indispensable to becoming a transformative leader. As I indicated earlier on, medical doctors are role models. So if you choose a career to be a medical doctor, then you haven't made the mistake. You have made the right choice. As an outstanding physician that you intend to become, or you are on the way to being one as you enroll into medicine or the medical quota, you should realize that throughout your life, you lead a life as a physician and scientist. And that's the reason that during formal training, you go through your natural sciences, basic sciences, and then end up with clinical sciences, where there's application. Therefore, a physician scientist life is defined by your formal training, which includes both a medical degree, which you acquire through your formal training, and the background in biological and physical sciences. Your natural and basic sciences. I've had questions sometimes from students who have asked me, why should we study biostatistics, epidemiology, when we are becoming medical doctors? When did statistics ever become part of medicine? Why should we study mathematics? Why should you study physics? The answer is simple. You are not only a physician, but you're also a scientist. Therefore, for you to be a physician worth his salt, you need to have a very solid background of biological and physical sciences. And I would suffice to mention that modern day practice is evidence-based. Clinical decisions are based on evidence. And where do you get, in terms of hierarchy, the highest evidence that you can get is from experimentation, randomized controlled trials. And what's more, you need to conduct a systematic review of randomized controlled trials. And that cannot be done if your background is very weak. So you witness firsthand the interaction between different drugs, the success of key surgical techniques, and patterns among patients. And all these are insights that bring your practice or guide in research and accelerate discovery so that you manage your clients or patients better. So it's very important for us to understand that not only are we going to be physicians, but we are also scientists. So we are basically physician scientists. And that's why our background is supposed to be solid. Then self-compassion. As you start your career from pre-med to final year medicine, and you get admitted into medicine, into practice, I mean, in your career, you may face setbacks. And there is a tendency to become defensive and blame or berate yourself. Neither response is indeed helpful. Instead, respond with self-compassion. Be kind to yourself rather than judgmental. Recognize that everyone makes mistakes and avoid dwelling on setbacks. Self-compassion will contribute to your growth as a person, either as a pharmacist indeed, or a physician. So, medical practice, medical training is one of the rare careers, or indeed training, that one can undergo. This is a career where you are able to see your work and be proud that you have made a difference. And that's the reason that everyone aspires to become a medical doctor. If you look at the time that HIV came on the scene, this is a field where discoveries are made within a very short period of time. I'd love you to understand that when the first case of HIV was identified in 1981. 4 years down the line, we had the first medicine that was used, AZT. In another 10 years, we had protease inhibitors and reverse transcriptase inhibitors. And the triple combination came to being, and it changed the entire picture of HIV. What was a killer disease became a controllable disease. This is where you see the Lazarus syndrome. You basically see your work and appreciate what you have done. So this is a career that you never regret having gone into the career, but it's a career that requires a lot of dedication. You need to stand on very high grounds in terms of integrity. You need to be confident. You need to be curious. Therefore, mine is to encourage you and tell you that those of you who want to pursue medicine, you have made the right career. But be ready in your first year to face your mathematics, biology, chemistry and physics. As you get into your second year, you have your basic sciences, basic medical sciences, physiology, anatomy, biochemistry, your epidemiology, biostatistics, then pathology, pharmacology, forensic medicine, psychiatry. You get rounded and proceed into your clinical years, where you have to apply all that you learned and you have acquired in your basic sciences. Therefore, at this point in time, I would love to wish you well as you come into the career of medicine, or as you build your career in medicine, or as you're about to graduate in your career as a physician, to come and join most of these outstanding physicians. I know we know that currently we have a crisis, and you've seen the amount of work that physicians have put in, combining the role of one being a physician and a scientist. You know that COVID-19, first cases within a short period, the organism was identified, the entire gene structure was identified, and innovative measures have been put in place. And God willing, in the coming few months, COVID-19 will equally be a controllable and treatable disease. So may the good Lord bless you all, and thank you very much for listening to me. At this point in time, I will be ready to get any questions or indeed advice or indeed contributions from any one of you. I thank you so much for listening.
Thank you, Dean, College of Medicine, for your wonderful presentation. I believe that the participants have gathered a knowledge on what is the importance of choosing the career in medicine. As we frame the topic as, are you ready for the wave? I believe that the current participants will be ready to flow along with us in the wave, I believe. So the participants, if you have any questions, you can put that in the chat box so that our Dean College of Medicine will be able to answer the question. We have quite few participants. Are we having any questions? Okay, I think there's a question from Shanta Maharaj Singh. Okay, let me unmute the mic. Yes, Ms. Shanta Maharaj Singh, you're set to open the question. Your mic has been unmuted.
Good afternoon. I'm from South Africa, and I'd like to know, we've lost a bit of time already with regard to our South African students. Granted, it might equate to just a few days. However, having tutored online, I have worked abroad as well. So, you know, I am au fait with online tutoring, etc. How do we condense this, or how do we unpack this to our students? Or do you perhaps think, and this could come from a question of logistics, that with regard to the South African intake and considering COVID-19 and the fact that in our country it might only see some ease around September, that maybe our South African students should be considered for the September intake so that there is a steady rollout of the academia for the first year intakes? Just my thought when I was listening to the Dean.
I think that is a very, very important concern. And I totally agree with you that medicine has never been taught on YouTube. Medicine is a career that requires a one-on-one interaction. And noting that basic sciences, those who are coming in HPFP or indeed medicine year one, that is the most critical point in one's career. Because if one loses it or misses it at that level, then you are gone as a practicing clinician or indeed a physician. So, Madam, that is one thing that we shall take into consideration as we look at the dynamics of this COVID-19 or indeed the pandemic. Our desire really is to have our students on campus, but because of this invisible enemy, that hasn't been possible. It's a positive contribution and very important contribution. We are assessing the delivery so far, and we shall see whether the students just need to come and continue, or indeed we need to transfer them into another intake. Thank you, ma'am.
Thank you so much for accommodating that.
Thank you, ma'am.
Thank you, Ms. Shanta. Any other questions from the participants before we close up? Okay, so since there's no questions, Dean, once again, thank you for your available time on your busy schedule to elaborate on the importance of choosing career in medicine for the younger generation on this particular situation of COVID-19 outbreak. So thank you once again, participants. Thank you, Dean, for your presence and the wonderful presentation. See you all in our next session. Thank you, Dean.
Thank you for having me. Thank you.